So with that, I'm going to introduce Artie Kelly. She is here with Sheba, and she's going to do a presentation on Medicare, and we think it's a timely presentation, and we thank her for coming out.
Thank you.
I need water and drinks if you would like.
I'm Artie Kelly. I'm the certified Sheba counselor for Curry County. And Sheba is Senior Health Insurance Benefit Assistance. It is a federal program. The main program is called SHIP. And Oregon and one other state took on the name Sheba. California has the same thing, only they have a totally different name. What we are is we're part of, through the Business and Consumer Division of the government. We get grants to run it. I am a volunteer. I've been doing this for 5 years. Every year I have to be recertified, and every year I go to training classes, and then in the fall, right before open enrollment, I go to coordinators class and master class to learn about what's coming up, like this year. You know, there's been some changes this year. He brought up acupuncture. I just got a notice email today through the Center for Medicare Services, which is who talks to you about Medicare, gives the approval for any services and like that. They're going to start covering acupuncture. So that's brand new. So that's kind of exciting. So I'm going to announce that tonight. How many people are turning 65? Well, welcome. Okay, how many recently moved to Brookings?
What's recently?
In the last 60 days?
Oh, okay.
Okay, you always, in Medicare, you always have time limits on things. For example, when you move into the state, or you change locations and like that, you have 60 days to check to see if your plan works there and to change it or whatever. So keep that in mind. So when you turn, I'm probably getting ahead of myself because I do that. Medicare 101, Sheba Donna Delicat and Miranda are the regional contacts up in Salem. And so Medicare is full of acronyms. I'm going to go through this pretty quick. The regular class is 2 hours. So kind of hold your questions, write them down, and we'll pick them up at the end. Okay, I'm not going to go through the acronyms, but I mentioned CMS. OEP is open enrollment. That's from October 15th to December 7th. That's when you change plans. I always tell people, if you have a prescription drug plan, come in, check it out. See if we can find a better plan for you. An example of that is last year, or in 2018, I had these people come in, and he had a fairly expensive medication. And so we found him a good plan. This year they came in to check up, and we were able to save him $1,000 a year on one medicine. Okay, just by looking to see what was out there, because your prescription drug companies every year will change their plans, and I'm getting ahead of myself again. So, what did I do? There we go. I'm going to talk about the basics of Medicare, Parts A and B, and then we have some additional options. The main one is Part D, like drugs, prescription drug coverage. Part C is the Medicare Advantage plan. Your Medigap is a totally separate thing, and I'll just touch lightly on that. Sheba is a program that the service is free. Counseling, I take appointments the second and fourth Thursday of the month. On the books, you have an 800 number. You call that, put in the zip code, and they'll connect you to the coordinator for this area. And she sets up my appointments. Or if you want to talk to me directly, they'll let me know. we provide objective information about Medicare and related health insurance, and we kind of look over people who are turning 65. I kind of go over all this stuff with them, presenting options, what might be best for you, what you're looking at, and then I do not tell you what to do. I want to make that real clear. Okay? You decide. The last thing we want is for the consumer to say, well, she told me to do it. So you make the decision, you're adults. You make the decision, but I present it, so you look at your different options. Show you how to use computer-based information and resources and process enrollments. Also, there's programs that Medicare Savings Plan and then also Medicare Extra Help for people on low income. And we've got the card out there for that. Helping at decision times, what I kind of touched on before in the guide, this is on page 12. This is the new Medicare.gov website. This was put into effect on October 15th, the first day of open enrollment. It had a lot of bugs. And so what they would like you to do is create an account on here. And that way when you put in all your medications, you can bring up and kind of look at plans, Advantage plans or prescription drug plans. But once you get a drug plan, you can pull it up if your prescriptions change, take out what drugs or put in what drug, and then you will see what your cost is going to be for the rest of the year. You can get all that information. Once a month, or once a quarter, can never remember which, you get a report from Medicare on your doctor's visits and what Medicare covered and did not cover and like that. That will be put out on this now. I don't know if they're still going to mail it out for those who don't have internets or don't want to use the internets, but I know that's available on this now. Medicare has 3 answers. Sometimes, maybe, and it depends. So that's it. When you say, well, Artie, can I do this? Well, sometimes. It depends. It depends is usually the main one I use. I'm still working. Do I need to enroll in Medicare? It depends. If you are covered by an active work employee group, you can delay enrolling in Medicare without penalty, but not a COBRA. Okay. Medicare is a health insurance program for people 65 of age or older, people under 65 with certain disabilities. Social Security is the enrolling agency. Benefits are administered by CMS. The one thing, we know people who are disabled and they are on the Oregon Health Plan. After 2 years of being on disability, you automatically get Medicare. The rules have changed in Oregon. Once you get Medicare, you're on disability. Once you get Medicare, you are not covered by the Oregon Health Plan. So that's when you get to call me and find out you don't have dental or vision or anything like that. Okay? So Social Security is the enrolling agency. That does not mean that you have to go to the Social Security office. I let people know that usually Social Security does not know that much about Medicare. Because it's the same but separate. Okay, that's what I'm here for. Okay, it's hard to get Social Security people trained. I'll tell you a little story. I went down to the Social Security office, and my ex-husband, who I was married to for 17 years, is very sick. So I went down to get it set up because find out what his, what I would get for Social Security when he passes away. So this gal gave me a figure, which is twice the amount I get now. Now, of course, I asked her, are you sure? She said, oh yeah, I'm sure. Well, of course, I get a happy dance all the way out to the car. Well, then I went down with a friend of mine whose husband had recently passed away, and I was there for support. And I brought it up again. The gal who helped me said, no, that's not the amount you get. You only get this amount. And so they don't always know.
They call them the IRS.
Yeah. So, new Medicare card, which has been out for a while, so you guys probably, those who have it, probably have it already. This is the one you have to use now, starting January 1st. So if you still have the one with your social security number on it, go ahead and destroy it. This is the one that they will, Medicare will accept. This is the one with the new number. Medicare is 4 parts. Part A, hospital. Part B, medical. It has the word optional. I'll explain that in a minute. Part C is the Advantage plan, and Part D is the prescription drug plans. You have 2 options. You have Medicare A and B. Is the original Medicare. Part D is the prescription drug plan. Okay? This is when you can add a secondary insurance to cover out-of-pocket costs. This is the Medicare, which is a supplemental plan. You may have retiree benefits like PERS, employer coverage in some cases, and other types of help. Okay, most retirement plans require you to do Medicare. And they would have a secondary insurance. So that's normally how that works. And then others, by the time when you are eligible for Medicare, they say we're dropping this and you take that. Okay. Option 2 is the Medicare Part C, which is a Medicare Advantage plan. You must be enrolled in both Part A and Part B to get it. Okay, but it replaces Part A and B. And it has the D. It has everything, okay? It gets confusing because you continue paying the Part B premium, but most of the Advantage plans have a premium also. Okay? Now there's advantages to Advantage plan, and we'll get to that in a moment. Part A, hospital insurance. You know when the politicians talk about entitlements? This is one of our entitlements. Because we work really long and hard and we're entitled to it. Okay? It's premium free with 40 credits of work history, otherwise up to $437 per month. Deductible is $1,408 for the first 60 days, that should be 2020, of inpatient hospital stays. So, you pay the first $1,400 when you go to the hospital. Okay, then they do a per day deal. If you go to the hospital and you're discharged before 60 days, okay, and something happens, let's say you have a knee replacement and there's an issue, you have to go back in, you won't pay another $1,400. Let's say after you get out of the hospital and 90 days later, there's a problem with the knee and you have to go back in, you will pay that deductible again. It can have up to 5 benefit periods in a year where you have to pay a deductible. It gets confusing, but what they will do when you get the report from Medicare that I brought up earlier, it is going to tell you how many days you have left, you know, on your benefit period, and like that. Okay. And it covers room and board, supply. I know that the 170.50 is changed. I was updating it. You can go to page 8 in the guide, and it will give you the updated information. Home health. Okay. am I inpatient or outpatient? You will be given a form by the hospital that will state this, if you're inpatient or an outpatient. Medicare or observation. If you're receiving observation, Medicare will not cover it. Okay? Hospitals know this, so they most, will admit you. I was, November 2018, I was taken to the hospital in septic shock. They didn't know quite what was going on, but they went ahead and admitted me, even though I am stabilized in the emergency room. So rather than keeping me for observation, they said, oh, she smokes. At that time I did, so that's the problem. So they gave me a diagnosis. Okay. When the guy the respiratory therapist came in, he gave me the little thing and I blew on. He said, you don't need me. So when you're an outpatient, you go under Medicare Part B. Okay? So like for your colonoscopies, it's done on an outpatient basis, or this and that and other things. That's covered under Medicare Part B. Okay, Part B is premiums $144.60 a month, 2020, and $198 deductible for 2020. 20% cost share after deductible is met. There again, the deductible, the first $198 is your responsibility. After that, they pay 80%. Now the neat thing about it, for any of this, when Medicare pays, is let's say the doctor charges, I'm going to say doctor, but the doctor charges $120. Medicare has this list of how much they will pay. And when the doctor signs up with Medicare to accept Medicare patients and bill Medicare, they agree to that. So Medicare comes back to this doctor and he says, we will only pay $100. So the doctor writes off that $20 difference. Then Medicare will pay 80%, which is $80, and you're responsible for the other 20%, which is $20. And it's that way with everything, as the Medicare has this amount that they say they will pay on. This is all the money you're going to get, and then they will accept it. So if you're in a different city, and they say, oh yeah, we accept Medicare, ask them, do you bill Medicare? Because they can accept Medicare patients. Does not mean they're signed up with Medicare for billing. So if you're in a big city and you happen to have to go see a doctor or whatever or other, that's a good question to ask. Okay. They have preventive guide pages 9 and then 14 and 15. There's a whole list of preventive services that does not cost you a penny. Okay, there's zero. And it's that way under most insurance plans that came through with the Affordable Care Act. So like for women, the mammograms, smoking cessation, colonoscopies. When I quit smoking, I had a low dosage MRI thing, CAT scan thing to check my lungs. That was free through Medicare. So on page 14 and 15, you're going to have a list of all those items. Things not covered by Medicare is physical exams, routine vision, dental care, hearing aids, and long-term care. Okay. What is Medigap? Now we'll just touch on this real quick. It's an optional secondary health insurance. It is sold by private insurance companies. It pays after Medicare pays, and it covers the gap. So that $20, okay, the doctors, they will pay the $20. Okay, and in the guide from 30 to 35 goes into the different plans. There's like 10 different plans. It will cover you throughout the United States. Anywhere you go, the Medigap will follow. Okay? And sometimes it covers deductibles and co-insurance and extra days in the hospital like that. There was a Plan F that they have discontinued. However, if you turn 65 before 2020, you still can get it. Now, the key to it is for guaranteed issue, you can get it at 65, 30 days after you turn 65. Guaranteed issue is no matter what previous medical conditions you've had, they will accept you. They're a secondary insurance, so they don't have to. Okay? Otherwise, you may go to underwriting. Some companies basically accept everybody, but otherwise they'll go to underwriting and then they might say, well, you pay a higher premium, or no, we won't cover you, or whatever. Insurance agents will be able to help you with that. My job is to tell you what it's about. Okay. Other insurance that works with Medicare, like I mentioned before, employee coverage, retiree, TRICARE for life, CHAMPA. How many VA people do we have here? Okay. And Medicaid. One thing, I'm going to go back to Medicare Part B, the medical part of it. If you don't have to sign up for it when you turn 65. You don't have to. But when you do, down the road, decide to sign up, there will be a late penalty. Last year, it was 67 cents a month for every month you didn't have it. Okay, and that stays with you for life.
How much was it again?
If I remember correctly, 67 cents a month.
Oh, you pay that for life every month, even though you were enrolled on the second month?
Correct. Well, no, honey, no, no. Okay, well, thank you. When you sign up for Medicare Part B, okay, you have 3 months before your birthday month, and 3 months thereafter. Okay, if you go longer than that, okay, for every month you don't have it. Same way with prescription drug plans. Okay, they have the late PP for life. Now, they only go back to 2006. It's the furthest back they go and calculate the penalty from there. Okay. Okay, Medicare Savings Program, financial assistance with the cost of Medicare. Gross income is up to $1,500 a month. It will probably go higher than that. It will pay for the Medicare Part B premium. Depending on your income, it may also pay for the deductible and co-insurance, if eligible. If you have low enough income, like I had a client with $700 a month income, she would be eligible for that type of thing and some real help, you know, in having her medical taken care of. That comes out of Medicaid. Okay, Part D prescription drug plan. It is optional, but you'll pay more if it's delayed. Okay? Must be enrolled in Part A and B or both. And insurance is through private Medicare contracted companies, and the premiums vary depending on plan. And it covers self-administrated drugs prescribed. If it's like the doctor does it, that's under Medicare Part B. Okay? And this is in Guide 22 to 27. One thing you'll notice at the top of this book, now I notice a gal over here with Medicare and Me book, which is sent to you by the federal government. What Sheba has done is they have taken that book, rewrote it in English, and put it here. So at the top of each page, you're going to notice this little black strip with the individual parts to it. And it has an arrow showing you which part that you're going to be looking at. So that makes it a little easier to find what section you want to look at. This year, I have not found for open enrollment and stuff, I haven't found any prescription drug plan that did not have $435 deductible. Now the thing with your medication is the insurance companies will put it on formularies, okay, and they have different tiers. Usually tier 1 and 2 go into the, cover the generic brands. Tier 2 might have some unpreferred brand names and like that. Depending on the tier 1, you can buy it at the prescription drug plan copay, but it does not go against your deductible, okay? So you pay the copay amount. Tier 2 on some of the companies are the same thing. Your tier 3 is starting of the brand names, 4 and 5 is going up to the spend of your drugs. This year, when I was helping people with prescription drug plans, inhalers was horrible. They had just, the price on them changed and they were just insane. $90-some a month for an inhaler. So these people went and got a hold of their doctor, and their doctor changed what they used to a lower priced one. Same way with insulin, we hear that a lot. I encountered that with a couple people. Most of them were on the lower price and not the spendier ones. Your EpiPens are astronomical. I mean, you guys watch and stay informed, so you probably have heard those things, but I was just blown away with the inhalers. I got so mad. Hello. Okay. So here's the new thing. You log in, create an account. You can also go in without logging in or creating an account. You can go in just to look around. Okay. So to find plans, you would put the zip code in 97415, and it brings up how to get your, where do you get the coverage? Do you get help from Medicare, your state? That is the savings plan or the extra help. Are you involved in that? Okay, and you type in the drug, and it will even, you get 3 or 4 letters in, and they'll bring up a list of all, and your drug is usually right there on it. Okay, and one thing too is you're going to see a drug list ID number, and write that number down. Now, if you have a login, you won't need that, but this way your list of prescriptions can be pulled back up too. Okay, and that's just what I talked about. Okay, so you put all your medication in, and then it brings up the different pharmacies. Well, for the new thing, you have to hit all 3. We have Rite Aid, Bi-Mart, and Fred Meyer's. Okay. And then it will bring this up. Now this is old. I haven't updated this, but this will give you a good idea of what this is going to be. So this is Envision RX. The monthly premium is still around $14.60. The deductible is $435. You have your drug copay. Okay. All the drugs are on the formulary. So if you have more expensive drugs, they may not be on the formulary. Okay? And then it has 3 out of 5 stars. Once a year, the insurance division, Medicare, gets a hold of these different prescription drug plans, and depending on the customer service complaints, this and that and other things, they give them a star. If they get low stars, something they're put on probation, it will show up in this prescription drug plan that those people are on probation. Okay, yeah,
That's Part D, right?
correct.
And so you pay Part D, that's an additional $14 plus the Part B?
Correct.
Wow.
Okay, and usually, it's not too bad, it's, per month.
That's per month? for you.
Right.
So if you, the other one was 144, so you add them together, right?
Correct, yeah,
Okay.
Yeah.
Mhm.
okay. Okay, you bring it up and they're going to tell you, you notice here, cost for the rest of the year based on the medication and the premiums. Fred Meyer's here is $2,400. Well, in this case, Walgreens is $275. Look at that difference.
What?
Okay. In this case, and we'll see it in a bit, but in this case, Fred Meyer's is not in network for Envision. Okay? So that you pay the full price. Walgreens, they are a preferred pharmacy, and so you pay less. You can also pick up, what would it be for meal order? Okay, and that runs about the same. Okay, and based on Fred Meyer's, see, you're going to pay if you have out-of-network pharmacy, you'll end up paying $204.61 a month for your prescriptions that are, they're all every month. Okay? Well, here at Walgreens, $10.49 a month. Now, this is the type of stuff I help you with. Take a look at these and kind of analyze and compare plans and which would work the best for you. Okay, we do not have donut holes anymore. Once you get up to a certain amount of money each year, it's true out of pocket, it goes into what used to be catastrophic. You just pay 25% from there on out of the cost of the medication. Okay, this is showing GAP. This particular person will not fall into the GAP plan back in 2019. Okay. We find you a preferred cost sharing. Some plans have mail order pharmacies, and which would help with the cost. Okay, extra help program is another way to for people with low income. Provides up to $33.80 a monthly premium assistance. I think that might have gone up for people on lower income, like myself. I'm on those programs because my Social Security isn't high enough. It's a godsend. Lord knows it is an incredible godsend. Okay, Part D, Part C, Medicare Advantage Plan. Let's see if I can explain this easily. You must have Part A and B. You must live in the plan service area, and premiums vary by plan, and it's privately managed Medicare alternative. It can include prescription drug coverage. You cannot get a Medicare plan and an individual Part D drug plan. So if you take medication, and this is something I don't understand why they do that, because if you go from an Advantage plan to and don't have drug coverage, and you go to a regular drug plan, you're going to have the late fee. Figure it out. Okay. May have extra benefits, and it takes everyone regardless of health, unless you're in end-stage renal disease, and everybody pays the exact same premium. Now, one thing with the Advantage plans is the cost for them is going down each year. One of the plans, there's 3 companies in Curry County. There is MODA, Pacific Source, and Regions. Okay? MODA is the entire state except Lane County, which is up by Eugene. Okay? Regents and I think Pacific Source, you go to their website, bring up the doctor, the clinic, or whatever, and if they're on there and they are in network, they will cover them. I know I picked up Regents this year, and almost through all over the United States, they have doctors in network. And I just go to their website and find a doctor in network, and no matter where I am. You know, it depends, they're not in every state, but that's that type of thing. With most of the plans, lower cost, Regions has like 3 plans. 2 of them do not have medical, and do not have dental and vision. For extra $25 a month, you can get those 2 items, which can be beneficial. Most of the dental does not have comprehensive. If they do, it's 50% coverage for fillings and whatever. They don't cover dentures or anything like that. Prescription lenses for vision, it's pretty good. You know, the testing for vision is covered along with money towards the frames and the lenses. Okay.
Can I ask a follow-up, please?
Sure.
It says you have to have A and B.
Correct.
Then the C becomes your primary insurance, as if you would see A and B.
Right. This is where it gets confusing. You have to have A and B, but basically A and B is put to the side. You're under, it's like a private insurance company, okay, but it's called Medicare Advantage.
So this private insurance company takes care of everything, pretty much, and just, yeah.
Instead of the 20%, there's no deductibles, okay, with an Advantage plan. Your co-pays can be anywhere from $5 to $15 to see your doctor instead of that 20%. You know, with the plan I have, it's $15 to see my doctor. My specialists I have in Medford are in network, and I will be $45 instead of the $200.
Okay, so back to Part B. There are premiums, but if I get Part C, I still have to pay the premiums.
Correct.
Well, you pay premiums to the company, the private.
You still
insurance
pay Medicare the premium for Part B.
I'm just questioning that. I don't understand, because my mother is on Medicare, and she went to a Medicare Advantage plan, and she only pays them. She pays them $160 a month or something.
She's still paying her Part B premium.
She is? What, is it coming out of her Social Security?
Right, that's how she had it set up.
Oh,
Yeah.
it's coming out of her, well,
Right.
wow, I'm moving.
Now,
to
here's
Canada.
something I learned at the last master's class I went to last fall. Medicare, I give Medicare, you know, the $190-some, you know, or $80-some a month for Part B. They take that along with another amount, up to $850 a month out of the federal coffers, and send it, for example, to Regents for my Advantage plan. So we may pay $180-some for Part B Medicare, but Medicare ends up paying up to $850 to the Advantage plan companies for the Advantage
Does
plan.
it have restrictions on how that's used?
What do you mean,
Under
Deborah?
Part C, Well, let's say I have, I don't know, a whole bunch of extra benefits, dental and vision.
Mm-hmm.
When they get that 800 and something,
Does it cover that?
does it cover that, or what?
Yeah. Yeah, it helps cover than that. You know, if you have private insurance out of the marketplace, you're gonna pay that amount of money into the marketplace. Okay, that's what's underneath it all. You know, they give them that money for them to help pay the claims type thing.
So you're paying, I don't know if I'm phrasing this right, the deductibles on A and B
You will not pay the deductibles.
if you get this.
Correct.
See,
There's no deductibles. It's just you're paying the Part B premium.
Plus this. Okay.
I don't think they're going to tell you.
Isn't that right? You pay your B premium and then you pay an additional amount for C, right?
Correct,
Right.
correct.
So it's over $300 for the.
Now, with Regents this year, they had a plan, the one I picked up was $15 a month. Premium for my Advantage plan. I also go to the fitness center there in the shopping center in Harbor for free. That's covered. I got a card in the mail today where every 3 months I get $40 on this, like it's a little Visa card type thing to cover my over-the-counter items.
Wow.
Toothbrush, toothpaste, my denture stuff. You know, things like that, vitamins, all that stuff. So that comes out of the Advantage plan, so there is an advantage. Now, I have a friend up in Portland, type 1 diabetic, who in the last 3 years had a massive heart attack. He's 68 years old, massive heart attack, which is pretty standard for type 1 diabetes. He went on an Advantage plan where he got the most expensive, $177 a month he paid. Then he had to have a leg amputated. Last year, the first of the year, I went up and was there with him when he had part of the other foot amputated because of the diabetes. And trust me, this man took care of himself. It's just that's the disease. So he got the most expensive Advantage plan through Providence. And after the out-of-pocket was met, which was only like $3,000 to $5,000, they covered it 100%. So I tell people, if you are going to have a bunch of major medical coming up, you know, let's say you come this fall and talk to me through open enrollment, if you know that you're going to have some major stuff coming up, we just diagnosed for cancer, well that can get real expensive. You may want to go ahead and pay for the more expensive Advantage plan because your co-pays is less. That's when it gets down like to the $5 mark. And your out-of-pocket is less. So then they will cover 100%. So those are the type of things we look at when it comes to open enrollment time. You know, what's going on in your life, what you see going on next year. You know, we don't have crystal balls, but you know, you may know that this is coming up, which is what my friend did up in Portland, knowing that these were the type of things that were going to be happening to them.
So what's the downside of this Advantage plan? It sounds like it's better than the Medicare. What, is it more expensive?
Well, you have to pay a premium. Along with the premium for Medicare Part B, you also pay a premium for
So you
this.
put out more monthly than on even the lowest price of the Advantage plan. You'd end up paying out more premiums each month.
Yeah, but you don't have the deductibles. I mean, it's kind of like you make the decision.
So the only way I wouldn't pay is if you didn't have any medical problems, or hardly any medical problems.
Correct. Yeah.
So does this take the place then of the Medigap plan with the private insurance?
Great
company?
question. If you have this, you cannot have
Okay, so it's either Part C or, well,
A, B, D,
Yeah,
or C.
okay, gotcha.
Yeah, option 1, which is like on page 6. Okay, have I totally confused you?
Yep.
There's different types of Advantage Play HMOs. All I'm going to say is we do not have HMOs in Curry County, so they're all preferred provider. Okay? How to enroll in Medicare, it's automatic, 3 months before your birthday month and your birthday month and 3 months after. You'll get the card in the mail. It says, do you want to keep Part B? If you don't, send this back. If you want to keep it, just keep it. And it'll automatically start being deducted by the Social Security check. If you're not getting Social Security, you have to pay 3 months premium at one time. Pay quarterly, for 3 months at a time. Okay? Anytime, all I'm going to say, I know, and I'll help you with open enrollment, or when you initial enrollment. The one thing when you talk to Medicare or Social Security, document, document, document. That means you write down who you talked to, what day you talked to them, and what time. What questions did you ask, and what was their answer? Salem has told me there's been cases where they've gone back, the tape is pulled up, the recording, and they found out that the person gave wrong information, and there has been a couple instances where they went in by what they said, even though it was wrong. That's rare, but it has happened. Okay, so document. Okay. Okay. Employee group, you can delay, blah, blah, blah. Talk to me, or when you call, say, the 800 number, if you do not put in your zip code, it will put you to the people in the office, and they are very qualified to answer questions. Okay, annual enrollment, October 15th to 7, Advantage open enrollment. This is cool, okay. January 1st to March 31st, and those are for those leaving Medicare Advantage plans over. I had a client the other day, wanted to go from it. He signed up for Advantage plan when he moved here. He wanted to change over to, which was only a couple months ago. He wanted to change over to Part A and B and then get a prescription drug plan because he got a supplemental, a Medicare. And so he could not be on an Advantage plan. So we were able to change him because of that. Okay. Late enrollment, okay, kind of went over that. Late enrollment for Part D, PERS, federal employee. Start getting your information early. You can contact us or call Center for Medicare Services, document, and schedule a free individual counseling center. And thank you again. God, I did it in this amount of time. Okay. Any questions?
I just want to emphasize how important this is. 2 years ago, I was paying Pacific Source $119 a month, and my wife was paying $119 a month because we're both in Social Security. It went up to $120 the next year. Or what? It started at $120, went down to $119. This year it was going up to $120. I was all set to stay with them, and I talked to someone, and now I'm on Regents, and I'm paying, each of us is paying $15 a month. And I have that little card in my wallet that says when I go into the over-the-counter, I can get my dental supplies, I can get incontinence supplies. Can't get beauty aids, but I can easily spend $40 a quarter, so that I'm now paying $5 a quarter. Now, I haven't been back to the network to see my primary care person yet. That's next week. But I'm pretty sure I'm covered just as well. I can still order my statin drugs by the quarter and have them delivered to my mailbox. Under Pacific Source and CVS, it was an email or a phone call. I didn't have to go into the pharmacy and stand on. But again, significant difference. And the reason why you need to take advantage of this service every year, because, as she says, it changes. And that's a big amount of difference. Co-pays are close enough that, it was breakage. So,
Yeah, thank you. Thank you. God, good thing we have this on tape. I can play it all the time. He can be our little star man. One thing I'm going to bring up before we go too much farther. I am the only counselor in Curry County, and trust me, I'm not whiny. I love this. I can be in the pissiest, oops, I'm on tape. I've done pretty good, haven't I? I can be in really kind of a down mood, just really, well, whatever. And by the time I get done with a client, we are laughing. I have only had one client in 5 years that was not happy when they left. Because I said, I'm not going to say what to do. But all my clients, we end up laughing and having a good time. I insist on that. This is a difficult thing, overwhelming. And let's just have some fun figuring it out. Did I see a hand?
So it was 67 cents a month if you don't sign up for Part B, for life penalty.
I would double check on that amount because my brain's kind
Well,
of
minus a penny
Sure,
or two, it
sure,
doesn't matter.
sure.
What is it for Part D?
same thing.
So another 67 cents.
Correct.
So you have it twice if you
Yeah.
Okay. All right. And for Medicare, it's Medicare Advantage plans, we call Regis to get the detailed information?
Yeah, or make an appointment with me. I've got all
make it-
that.
okay.
Yeah, I've got that all.
Oh, you have their information?
Yep, and I
like
can
the
enroll you if you
co-pays
decide or whatever.
and- Okay, great.
What is your number, please?
Is it somewhere there?
The 1-800 number,
772-1213?
yeah, and put in the zip code, and they'll connect you to the coordination site, which is in Coos Bay.
Do you charge for your services or, no?
No,
Have to go see you in Coos Bay?
no, I'm here in Brookings. I live here in Brookings, but they just make my appointments for me.
And what was your name again?
Ardy. A-R-D-Y. And if you want me to call you, thank you, dear. And I can set up an appointment. There's a list back there. Put your name and your phone numbers on it, and then I'll give you a call. And we'll skip.
Which number is yours on this? 722-4134?
That is the Salem number. In the back, the young lady in the back is holding up a sheet
Oh.
to sign
If you
up.
want to sign up to have her call you and make an appointment, just leave your name and phone number here.
Oh, okay.
Yeah.
Oh, sorry.
I have a question.
Sure.
He's got his insurance cards
Uh-huh.
for Social Security disability. I am still working and I carry the insurance. Does he need to sign up for?
That depends.
Will they charge us a late fee if
You
we
know,
not sign up?
Tonight, I'm tired, so I'm not going to answer that question.
Okay.
So I will look into it and put your name and phone number down, a little note, and I'll find you the answer.
Okay, great.
Yeah, my brain is just kind of overloaded.
I'm confused, so.
I just went on the age thing, I got my card, I think, last year, November,
Okay.
December. I didn't send anything in, so I'm assuming they're gonna sign me up for the league.
Correct.
So, how long do I have before do I have the full till April or May to actually decide if I wanna change it or add it to C? Or what's the time limit for me to make that decision so I don't get penalized?
So you just got on Medicare.
I'm not there yet, in March.
In March, but
In
you
March.
got your card.
I got my card.
Okay, well, you can come in, since you have your card, come in and we'll take a look to see what works best for you.
Okay. And so what would be my time frame? Do I have plenty of time to
3
do
months
that? or-
before your birthday months, and 3 months after.
Oh, cool, okay.
Unless your birthday falls on the 1st, and then it depends.
So March 3rd. Yeah.
That's, yeah, one of those exception
I
things.
have one more question.
Sure,
Sorry, I
absolutely.
feel like that one.
That's okay.
So, let's just pretend, let's theorize I sign up with Regents.
Okay,
So I'm paying my Part A, 144, or
Which-
whatever it is.
Part B.
Part B, right, Part B,
Right.
whatever it is this year.
Mhm.
Do I still pay that Part D? Or do I?
No, Regents would include the
That would
prescription
be
drug
included
plan.
in their premium?
Correct.
Okay, thank you.
Yeah.
All right.
Which $15 a month, let's say you pick that one up, it's
Yeah.
less than what,
Mhm.
you know, your prescription drug plan would be.
Right. That's what I'm saying.
So you're
Yeah.
paying the same if you pick up that particular one, which a lot of people did this year.
Yeah.
What's the difference between a supplement and the Advantage plan?
Great question. What the supplement will do is, let's say that you have, the Part B has the $198 deductible for, medical, okay? Some of the plans will cover that, okay? Let's say, like I brought up in the example, the doctor charges $120. Medicare says we'll only pay a total of $100. So they pay 80, you're responsible for the 20.
Right.
The supplemental will pay that.
And it
Okay.
pays deductibles too.
Correct. And if you go to the hospital, nada. If you, your ambulance bills, nada. You have to fly to Medford, nada. It covers everything, depending on the plan you get. Let me put it that way.
Yeah.
Okay, so Plan G is one I talk to people a lot since we can't do F yet. It does not cover Part B deductible, the 198. Otherwise, it pays for everything. Okay? Okay, on the volunteer work, I'm going to come back to that. I don't want you to sit there and say, oh geez, I can't get up in front of people, blah, blah, blah. You don't have to. What you volunteer for is just to sit down with people like yourselves and help them find what they need in a prescription drug planner like that. You have training, new volunteer training, 2 days. I get room and board. I get mileage. I go to, it's wonderful, I can go out of town for a couple days. You take tests online through Center for Medicare Services. To become certified, you do 12 credit hours. You also go to training one-on-one with me. You will not have a client till after you do 6 months of shadowing. And that is just sitting in on appointments and watching before you do your own. So they're very, very good at making sure that this isn't overwhelming. So if anybody wants to, find out more about it, like I said, right now, this time of year, I go and have appointments the 2nd and the 4th Thursday of the month. So it doesn't take up much of my time, and,
Where are the trainings? Where are the trainings held usually?
Well, we've had it in Sutherland and Medford and Salem.
Various.
Yeah, mostly it's in Southern Oregon
Okay.
that we go, yeah. So that's not bad. So it's kind of fun.
So, in order to have a consultation with you, I won't turn 65 until August,
Okay.
but I need to have my card first before I have a consultation with you.
I always tell people when you get your card, because that way if you sign up for anything, you need your number.
Okay.
So I always tell people to,
When do you get a card?
Huh?
When do you get a card? I turned 65 in April, I don't have a card yet.
You should anytime.
So,
Or no, March, yeah.
now you were March, right?
Yeah, I'm a March
When did you
birthday,
get
and
your
I got,
card?
I want to say November, or December.
Yeah.
Yeah, it just varies,
Okay.
just varies.
All
Yeah.
right. Right.
Any more questions? Well, I am so glad you guys are a great group. I usually do one-on-one classes, which is normally 2 hours, a couple times a year. And definitely one, or maybe once a year, definitely before open enrollment. And so hopefully we'll see you again, you know, and talk to you and like that. Just set up an appointment or call me. Or I'll call you if you're interested in becoming a volunteer, because it is a lot of fun. I have a good time with it. Thank you.
Thank you.